The news day continues here on One News Now. I'm Chicky Verhel. The health department records less than 2,000 new COVID-19 infections. Total active cases, or those undergoing treatment, are at 28,000, while the country's total caseload is up at 2.74 million. At least 309 more patients, however, did not survive the disease. This brings the country's death toll to over 45,000. Meanwhile, more than 3,000 patients recovered from COVID-19 overnight. Total recoveries are now at 2.74 million. Positivity rate in the country remains low at 3.9%, and this refers to the number of people who were found infected of COVID-19 among all who got tested during a particular period. Almost 1 million minors have been vaccinated against COVID-19 since the start of the inoculation drive about a month ago. Vaccine czar Carlito Galvez Jr. bared that many local governments were supportive of the government's vaccination efforts. Galvez expressed confidence that the country would be able to vaccinate all those aged 12 to 17 by year end.
We are very happy na talagang very receptive at saka ang lahat ng mga LGUs at ang lahat ng mga regions very happy na nag-open up na tayo ng 12 to 17. Ang hinihintay na nga nila is yung kung kailan mag-open yung 5 to 11. So we are very confident na makakaya natin yung mga ating minors na 7 to 7 yung 12 to 17 matapos natin yan by the end of the year.
Galvez also assured the public that the supply is enough to jab 100% of the target population in NCR by February next year. Based on recent government data, more than 8.8 million individuals, or over 90%, have been fully vaccinated in the metro.
We are confident that we have this steady supply for the need for the National Vaccination Day and also for the whole year until the end of December. Yung 54 million yun, hindi natin kaya mabusin yun. And then we have still, before the end of the year,
A virologist from Johns Hopkins University looks at booster shots as long-term prevention for COVID-19. Let's watch this report from Bloomberg.
Is taking a harder stance or taking Singapore's stance of just kicking people off healthcare if they don't get vaccinated? Is that what has to happen to get more people vaccinated? Or have we moved to a place where it's really an individual choice and the public health concern has been really stripped away more significantly?
It still is the important thing is to get people vaccinated, and it starts with a safe and effective vaccine, and other ways you can move forward to get that in the population are things that are needed to be done, because we won't boost our way, as many people have said, we won't booster our way out of this pandemic. We have to get everybody to either get the vaccine or do things the hard way and suffer through infection to try to get some level of immunity. And we don't want the latter because of the cost that takes, not only on human suffering, but also the overload that it puts on our hospital system.
Do you assume, like tetanus, we have a reboost X number of months / years out?
So this is the most important thing about boosters that I feel isn't really talked about much, and that's COVID-19 is here to stay in the human population. We have to find now a way to turn these immunization strategies into ones that get us the longest and strongest immune response. Up until now, we've been focusing on short-term responses, getting protection in the population quickly. We've got to start rethinking these immunization schedules to induce long-term antibody levels. And I don't think that's going to need an annual booster, but it may take a booster over the course of, let's say, 2 or 3 years and a different schedule of vaccination to give us that long-term immunity that we need to keep this virus away for an extended period of time.
Following 2 weeks of high-profile negotiations for urgent climate action, world leaders have come to an agreement at the COP26 summit. Almost 200
Tackling
nations
climate
accepted
change
a
requires the
compromise
world to
deal
remove
aimed
more
at
greenhouse
keeping a
gases
key
from the
global
atmosphere
warming
than
target
continuing
alive.
to emit.
However, it contained a last-minute change that watered down crucial language about coal. The summit broke ground by singling out coal, however, weakly by setting the rules for international trading of carbon credits and by telling big polluters to come back next year with improved pledges for cutting emissions. The United Kingdom hosted the COP26, where a number of pledges have already been made for climate action. Let's find out more in this video.
First establish the necessary, especially in remote and disadvantaged areas. We must also promote key areas where we can collaborate more for an inclusive.
Let's now take a quick look at today's other top stories. President Duterte called for closer international cooperation at the 28th Asia-Pacific Economic Cooperation, or APEC Summit. He said this would hasten the economic recovery of Asia-Pacific states from the COVID-19 pandemic. The chief executive also stressed that improved risk management systems as well as better response and mitigation measures are needed. More tourist destinations are waiving the RT-PCR or swab test requirement for visitors who are already fully vaccinated. These include the Boracay Island, Baguio City, Subic Bay, and over 15 more provinces. The tourism department said vaccination cards issued by the health department or an LGU would suffice. And oil companies are seen to roll back gasoline prices this week. Unioil projects that the prices for diesel would not change, but those of gasoline are expected to go down by 90 centavos to 1 peso per liter. For more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Chicky Verhel. Mask on, wash hands, and stay safe, Philippines. We are One News.